Hey everybody, Dr. Wienke here, and I wanted to talk to you guys today a little bit about total contact casting. So if you look at all of the studies, everything that's been published on how successful we are at healing wounds on the bottom of the foot, studies will show at 12 weeks we're somewhere between 20 and 30% successful. So that's not great. When we look at total contact casting, the studies show at 6 weeks we have about a 92% heal rate. So that's over 200 times greater chance of healing in half the time. So I'm a big fan of total contact casting. I want to talk to you guys today about the EZ Total Contact Cast kit. This is a kit that we use in our office all the time. Everything comes pre-packaged. Nurses will take that out of the wrapper. This patient in particular has an ulcer on the bottom, so there's a dressing that comes with. They'll put the dressing on first. After that, there is a stockinette layer. And so the stockinette will slide on. We have to take very special care to make sure that the stockinette is not bunching up the dressing. We also want it to be nice and smooth, so there's nothing that is going to get rolled up. You can see we cut off the excess and throw that away. We have to be very careful that we don't cause any new wounds with the cast. So next we put this padded layer on. There's a pad over the shin, and then there's padding over both sides of the ankle. Again, you'll see the nurse is taking very good care of this patient, making sure that there's nothing that we're going to do that's going to cause a new ulcer while we're in the cast. The cast will then go over the bottom of the foot. You can see the nurses here are taping everything down. Now the tape never goes around the foot or leg to make sure that we don't cause any issues with circulation. You can also see the tape is never secured to the skin, only to the stockinette. We want to make sure there's plenty of room at the end of the foot where the toes are so nothing gets squished or pinched there. And then we roll on this really thick, heavy-duty padded layer. Again, once we do that, we're going to make sure that everything is nice and smooth, that there's nothing bunched up, nothing rolled up, nothing that's going to cause a new ulcer. We fold the top layer down and we tape that in place. Once we're doing that, the doctor will be getting the fiberglass layer wet, which is what activates it, and then the doctor will roll the fiberglass layer on, much like that padded layer. Again, we'll make sure that there's plenty of room for the toes, and we fold the top of the cast down to make sure there's nothing sharp on the top of the cast. We'll then bend the ankle to 90 degrees, and we bend the knee and hip, and we rub the cast until it dries. We have to sit with the cast for about 15 minutes to let everything set up. The nice part about this system is there's a boot that goes over the cast. This can be removed when you get home at night so you can get into bed and not have to track everything that you've stepped in throughout the day in the bed with you. The boot works much like a cam boot. There's a series of 3 or 4 Velcro straps. You'll secure those, and then the boot is ready to go. You can pull your pant leg down then over the boot, and patients are able to walk with the boot and the cast on. And you can see this patient, once she's all ready, walks right out of the exam room and right out of the clinic. And so if you've got a wound in the bottom of your foot and your doctor has not talked to you about total contact casting, it's time to start asking some questions. Check us out on Facebook, the internet, capfootandankle.com. Come by, give us a call. We'll see you next time.